Today our topic is anatomical nomenclature. ह्यूमन बॉडी थाउजेंड ऑफ स्ट्रक्चर से मिलकर बनी है, इसलिए उन स्ट्रक्चर्स को जानने के लिए बहुत सारी जो स्पेशल टर्म्स हैं वो डिवाइस की गई हैं, जिनमें से मोस्टली लैटिन और ग्रीक लैंग्वेज से ली गई हैं। मेडिकल स्टूडेंट को एनाटॉमिकल लैंग्वेज समझने के लिए इन तमाम वर्ड्स या टर्म्स के बारे में इल्म होना लाजमी है। अब व्हाट इज़ एनाटॉमिकल पोजीशन? In this position, the body is regarded as standing erect, eyes looking forward to the horizon, the upper limbs hanging by the sides with the palms of the hand directed forward, and the feet are together with toes pointing forward. हॉरिजॉन की तरफ जो है ना आइज़ देख रही हूँ। हॉरिजॉन क्या होता है? जैसे एक रूम है, उसका एक होता है फ्लोर और एक होता है रूफ़। तो रूफ़ और फ्लोर के बिल्कुल मिड पॉइंट पे जब वॉल की तरफ देखेंगे बिल्कुल सेंटर में, तो वो हॉरिजॉन कहलाएगा। तो बिल्कुल सीधा देखना, ना ऊपर और ना नीचे। In this image you can see body standing erect, eyes looking to the horizon, upper limbs hanging by the side and palm directed forward, and foot are together directed forward. For description of relations, various planes have been proposed. Median plane, coronal plane, transverse plane. What is median plane? It is a vertical plane which divides the body into right and left equal parts. You can see from this image vertical line dividing body into right and left equal parts. It is a median plane. There is another plane, that is sagittal plane or parasagittal plane, paramedian plane, which is any parallel plane to the median plane which divides body into right and left parts, but they are not equal. Then there is a coronal plane, which is any vertical side to side plane at a right angle to the median plane. It means that it is also a vertical plane but right angle to median plane and divides body into anterior and posterior equal parts. You can see this picture. It is also representing coronal plane, which is a vertical plane perpendicular to the median plane, dividing body into anterior and posterior equal parts. Then there is a transverse plane, which is a horizontal plane dividing body into upper and lower equal parts. This picture represents transverse plane, which is a horizontal plane dividing body into upper and lower parts. As we know, body parts are various and there are descriptive terms used for these relationships among the body parts. So there are many terms of position and terms of movement. Terms of position includes these all terms: anterior, posterior. Anterior is toward or at the front surface of the body, posterior toward or at the back surface of the body, medial toward the median plane of the body. As we know that median plane is a vertical plane that divides body into right and left equal parts. So any body part that is toward the median plane toward the center is medial, called as medial, and away from the median plane is called the lateral. Superior and inferior toward the top of the head and inferior toward the sole of the feet. Superficial nearer to the surface of the body and deep farther away from the surface of the body. For example, your skin. Any muscles are nearer to your skin, but the bones are deep. Another is internal and external. Internal is nearer to the interior of the body or a body part. External farther away from the interior of the body or a body part. Proximal toward the origin or beginning of a structure, and distal away from the origin or beginning of a structure. Palmar pertaining or to the front surface of the hand, and plantar pertaining to the sole bottom of the foot. Palmar is used for the hand and plantar is used for the foot. Some other terms are also used, for example dorsal, which means toward the back, ventral means toward the belly. Other terms are cranial, cephalic and caudal. Cranium, we know that represents skull, which encloses brain, but this term is used for body parts that are located in the cranium or directed toward the head. Cephalic also means located on the head or situated near the head, मतलब any part of the body that is toward the head, close to the head. Caudal means tail or toward the tail, any body part that is away from the head and toward the tail. Now there are many terms of movement: flexion and extension. At many joints of our body, flexion and extension are possible. As you can see from this picture, at elbow joint, flexion of the arm and extension of the arm is possible, and at the knee joint, flexion and extension of leg is possible. Flexion is basically means decrease in any angle at any joint, and extension means straightening of motion means in which angle increases at any joint. In this picture you can see flexion of head, and in this picture you can see extension of head at the neck. Picture shows you flexion of hand and extension of hand, and in this picture you can see flexion of whole upper limb, and in this picture you can see extension of upper limb. This picture shows you dorsiflexion and plantar flexion means when you move your foot toward the dorsum or toward the leg front side, you can represent it as a dorsiflexion, and plantar flexion, as we know that sole of the foot is also called plantar surface, then toward that surface movement of the foot is plantar flexion. Flexion of trunk and extension of trunk is also possible. As you can see from this picture, this is flexion and this is the extension. Other terms are abduction and adduction. As you can see from this picture, when you move your arms toward the thorax, then thorax or trunk, this is adduction, and when you are moving your arms away from the body, then they are abduction. As similar with the lower limb, moving your leg away from the another leg, then this is abduction, and moving toward your leg towards the other leg, then it's adduction. As we know, add means जमा करना, तो उसी हिसाब से होगा कि एडक्शन पास लेके आना या दूसरे के साथ मिला देना, और एबडक्शन अवे. These pictures are also showing you adduction and abduction. Moving your fingers toward the median plane is adduction of fingers, and moving away is abduction of your fingers. As similar in foot, when you are moving your fingers away from the median plane, then these are abduction, and moving toward, then it's median plane. But you can see that median plane representing your hand and foot is considered as a middle finger. As you can see hand, this middle finger is considered as median plane, and in foot this second toe is considered as your median plane. So according to this median plane, when you move your fingers toward this plane, these are adduction, and moving away, then these are abduction. Flexion, abduction and adduction of thumb is different as compared to the other fingers. For example, when we are saying about the adduction of the thumb or abduction, then movement will be as similar as this. At the right angle of the other fingers, this is abduction of the thumb, and moving toward the finger, this is adduction of the thumb, and moving away in this plane, then this is extension of thumb, and this is flexion of the thumb. Pronation and pronation are other terms in which palm is facing toward the front, and in pronation palm is facing backwards. Image is showing you circumduction, in which we perform all the movements. For example, flexion, extension, adduction and abduction. All these terms are collectively called circumduction. Now, inversion and eversion of the foot is representing in these images. Toes moving toward each other is inversion, and away from each other are eversion. And these pictures are showing you protraction and retraction. Moving your lower jaw front toward the front is protraction, and toward the backward, this is retraction. And what is elevation and depression? Joining your both jaws together is elevation, and separating them is depression. This shows you opposition and reposition. Opposition means facing other fingers with the thumb, and reposition means moving them backward to their original position. There are some terms of laterality. बाईलेटरल मीन जो स्ट्रक्चर्स हों वो बॉडी के दोनों साइड्स पर, मतलब राइट और लेफ़्ट दोनों साइड पर मौजूद हों, तो उसके लिए हम टर्म यूज़ करते हैं बाईलेटरल. जैसे कि कान है, आँखें हैं, दोनों दो प्रेजेंट हैं हमारी बॉडी में, तो इनके लिए बाईलेटरल टर्म यूज़ की जाती है. लेकिन अगर हम इप्सिलेटरल की बात करेंगे, तो हम एक ही साइड की एक पार्ट लेंगे, स्ट्रक्चर लेंगे, और उसी साइड का दूसरा स्ट्रक्चर लेंगे, और उनका आपस में अगर जब रिलेशन बताएंगे तो उसके लिए हम इप्सिलेटरल यूज़ करेंगे. जैसे कि राइट हैंड को हम राइट फुट के हिसाब से देखेंगे तो, और कॉन्ट्रालेटरल डिफरेंट पार्ट्स तक के लिए टर्म यूज़ की जाएगी, जैसे कि ऑपोजिट साइड पर भी हों। एक तो ऑपोजिट साइड पर भी हों और हों भी पेयर फॉर्म में, जैसे कि अगर हम राइट फुट की बात करें लेफ़्ट फुट के हिसाब से, तो वो होंगे दोनों, एक तो पेयर होंगे और क्या होंगे, दोनों साइड पर मौजूद भी होंगे। यूनिलेटरल उन बॉडी पार्ट्स के लिए यूज़ किया जाती है टर्म जो कि बॉडी के किसी एक साइड पर मौजूद है, जैसे कि स्प्लीन है या फिर अपेंडिक्स है।